Hello, good afternoon, everyone. Thank you for tuning in to today's webinar. My name is Dr. Joyce Tang, and I'm very happy to share with you what our team does at SGH ENT department. And myself and my colleague, Dr. Vanessa Tan, would be presenting two different topics about our hearing. Next slide. Myself, I'm a consultant at the department, and we focus on hearing and hearing implants and other parts of the ear as well. Okay, next. Any other slides? And Dr. Vanessa Tan, she's the head of the Hearing and Balance Center, head of the Otology, which is the ear subspecialty in ENT and SGH. She's currently held up seeing patients in the clinic, so she will join us later. Okay, I'll be covering causes of blocked ears, and I will describe more about it in later slides. Okay, shall I share my slides?
Yes, you may.
Okay. You might have to stop share because I can't share. Okay. Can you hear my, can you see my slides?
Yep, go ahead.
Okay. Okay, so once more, today I'll be covering causes of blocked ears. This is a medical diagram describing how we hear. So this is the auricle, or what you know as the external ear, and this leads to our ear canal, or also known as the external auditory canal. So the sound waves come in, collected by our external ear, and it concentrates all the sound waves into the ear canal. And then this then vibrates the tympanic membrane, also known as the eardrum. This eardrum is connected via three ossicles or little ear bones, the malleus, the incus, and the stapes. And this final one, the stapes, connects to the inner ear in the cochlea, where all these sound waves are then changed and transformed into electrical signals, which then go through the cochlear nerve into the brain. Okay, so one more time, external sound is collected by our pinna or the auricle, and it then goes into sound waves which go into the external auditory canal, which then vibrate the eardrum, which then vibrates the malleus, incus, and stapes, the three middle ear bones, which then transmit the sound into the cochlea, which is the inner ear, which then changes it to nerve signals that goes to our brain. Okay. Myself, I'll be focusing today's talk on the middle part of this. So this part that is outside of the eardrum is considered the external ear. The part that is from the cochlea or the inner ear is the inner ear, and everything in between is the middle ear. Okay, quite easy. External, middle, and inner ear. The middle ear space is connected to this thing called the Eustachian tube. And don't worry, I'll be going through more of this. So I'll be covering the basics of the middle ear and the Eustachian tube, normal structure of the Eustachian tube. And then I'll be covering what can go wrong with this Eustachian tube, also known as dysfunction. So firstly, it can be blocked or it can be too open. And then lastly, I will end off with what can we do about it. Okay, so what is this Eustachian tube? As I showed in the first slide, it connects the middle ear to the nasopharynx or the back of the nose. So this is the front of the nose and it connects to the back of the nose. And what does it do? It helps to equalize air pressure between the external environment, the atmosphere, and the middle ear. And I'm sure many of you have experienced a pop in your ears, especially if you blow your nose sometimes, or if you sneeze, or if you take a plane, or sometimes even if you take a lift to a very high floor, you might feel like there is a pop in your ears. Okay, so sorry. Okay, the next thing is it also drains the fluid from the ear, which is formed naturally, gets into the throat. And this happens completely without us knowing. And the last thing I want to show you in this slide is, this is the Eustachian tube in the adult and in the infant, in a young child. So there is a bit of a shape difference. If you can see in the adult, this tube is a bit more slanted. And in the infant, this tube is a lot more straight. Okay, so actually, our nose and our ears are connected in this way through the Eustachian tube. And you know, we always get flu and colds or upper respiratory tract infections. And so in a child, because this tube is very horizontal, bacteria and viruses can travel between the ear and the nose more easily, which is why for those especially who will work with children or have children, a lot of times children get ear infections due when they get a flu, whereas in adults, this is not so common. Okay, so the most common problem with this Eustachian tube is a blocked Eustachian tube. So when it gets blocked in the nose, you will feel like your ear feels blocked. You might feel like your hearing is muffled. But if you blow your nose and it pops, you feel like you can hear better. But typically after a short while, like a few minutes, it will feel muffled again. Another thing you might feel if you have Eustachian tube dysfunction is you might feel pain if there is a change in the altitude. For example, as I mentioned, if you take a lift, when you go from the 0th floor to the 44th floor, for example, you might feel pain. Or if you're taking a plane, same thing, you might also feel like there is pain. Or if the opposite of going up is you go down, if you go diving, for those who have dived before, you must be able to pop your ears. Otherwise, you cannot dive. You will get very bad pain and you will not be able to continue diving. So what is usually associated or comes together with Eustachian tube dysfunction are upper respiratory tract infections, flus, colds, or sinus infections, which are from the nose, it goes to the sinuses, it's a bit of a deeper infection. Or simply, which is very common in Singapore, allergies. So a lot of Singaporeans have allergies, dust mite allergies and all that, and that will lead to nasal congestion, which then leads to Eustachian tube dysfunction. Of course, for smokers, there can be irritation from all the smoke, and you might get the same problem. Or if you are born with a cleft palate, then you might also get this problem. So what can happen? I mean, so what? Eustachian tube dysfunction, is this a sensation? Nothing serious? For some people, yes, it's nothing serious, but you may get some complications. So remember I said that what is the function of the tube? One is for air pressure equalization. The other is to drain fluid. So if it doesn't work, you might get fluid buildup, or it can even be pus, because if you're having an infection. So if you have fluid buildup in the middle ear, then it impacts the eardrum movement, and then you have hearing problems. And of course, when there's pus behind the eardrum, this infection can sometimes lead to a perforation or a hole in the eardrum. The other function of the Eustachian tube is to equalize the pressure. If there is no pressure equalization, there will be a negative pressure that develops in the middle ear. And this constant negative pressure pulls on the eardrum constantly, and it leads to eardrum becoming deformed and leads to formation of little pockets where skin and dirt can accumulate, forming this disease called a cholesteatoma. Not to worry, I have more slides on this later. And of course, lastly, if there is a sudden change and you're unable to stop the pressure change, you might get blood inside your middle ear from what we call barotrauma, trauma or injury due to changes in pressure. Okay, so if you get any of those symptoms, blocked ears, muffled hearing, pain or pressure changes, what should you do? Please see your family doctor, your GP, or even the polyclinic doctors. What will they do for you? They will check your ears, looking at your eardrum to tell you if you have any hole in your eardrum, to see if there's any fluid behind your eardrum, or any other complications. If they're able to, they can also do a hearing test for you, because sometimes it does feel like it's blocked, but actually you may actually have a hearing problem. If they will also examine your nose and your throat. And if they determine that there is an infection, they will give you some antibiotics. Typically, they will give you some oral antibiotics. But if there is a hole in your eardrum, they will have to give you some ear drops. If the GP suspects that you have allergies in your nose, and it's not an infection, it's just allergies, they will give you some nasal sprays or antihistamines, the flu medications. If you do not improve with treatment from your GP, then they might refer you on to see the ENT. They typically refer you on to see the ENT. And what do we do for you? Again, we check your ears. Might even put a camera into your ear so that you can see it as well. And then we always do a hearing test to definitely say whether you have or do not have any hearing loss. We also do a tympanogram, which is a special test to check the pressure behind the eardrum. We can tell if you have a negative pressure from chronic Eustachian tube dysfunction problems. And last of all, we do a nasal endoscopy, like in this picture. We put in the camera through your nose, and we look for any narrow nasal passage from a crooked nasal septum, or any infections, polyps, allergies, or even growths in your nose. How do we manage this? Sometimes if it's nothing too serious, simply popping your ears. So you pinch your nose and you blow hard against your fingers. So the air, instead of going to your nose, goes into your ears. And this is what we call the Valsalva maneuver. So this is able to relieve the pressure difference, and you should be able to hear better. If we do see any infections, we will give antibiotics as usual, or we might just give you some tablets for decongestants or antihistamines, the flu medications. And if we see a lot of inflammation in your nose, we will give you nasal steroid sprays, which reduces inflammation of the nose and thereafter of the Eustachian tube region. We might even give you a salt water to wash your nose to get rid of all the pus that can be in your nose. And if all this fails, after 2 to 3 months and you are still having very persistent symptoms in your ear or your nose, then we will advise for surgery. Okay, if you remember the complications that I mentioned, so this is the ear again, the ear canal and the eardrum, and this is the inner ear, and the space between is known as the middle ear, connected to the Eustachian tube here. So if there's a blockage in the Eustachian tube here, then there'll be fluid build up here. And when we look into your ear, we can see the fluid in your ear. Most times this gets better after 2 to 3 months after your flu or with the sprays that we give you. But if it doesn't get better after 2 to 3 months, we will put in a little tube through your eardrum, and this lets the water come out. So this is what we call a grommet tube insertion. This is a very small procedure that is done in the clinic. The procedure itself is like 5 minutes, although we do spend some time trying to numb your eardrum. So don't worry, this is not a painful procedure. It's only a day surgery. After the procedure, you can go back home and you can do everything as per usual. With a little tube in your eardrum, we do ask you to be careful about getting water in your ear. So you will have to protect your ear during your shower, not to let any soapy water get into your ear canal. One more thing to add, this little tube is expelled by the body. It's pushed up by your body gradually over 6 months or so. And so the body automatically pushes this out, and you don't have to do anything special about it. And hopefully by then, in 6 months' time, the fluid buildup would have resolved. Another problem that can happen is you might get a hole in your eardrum. Remember I said that if there's a pus buildup in your ear, there may be a perforation or a hole, and then that might be a permanent hole in your eardrum. And of course, with a hole in the eardrum, it affects the transmission of sound into your inner ear, and you will have hearing problems. So usually we will recommend a surgery if the hole in the eardrum doesn't go away by itself. Sometimes if it's a small hole, it heals itself over a couple of months, 3 months or 4 months. But if it's still persistent after 3 to 4 months, we usually recommend a surgery. So surgery, for example, this is my case. There's a hole in the eardrum at the back here, and we patched it up. And 2 months later, it's all mended up already. Okay. This is also a day surgery procedure, but it's not under general anesthesia. So you will not know what's happening. You don't have to experience any sort of pain. It's not a painful operation. After when you wake up, you're not going to be in pain. Your ear will be just a bit blocked for about 1 month or so. The next complication that I want to tackle is the cholesteatoma. So this is the eardrum, and you can see in this blue pocket. Let's look at this picture now. So this is the ear canal, this is the eardrum, and this is the middle ear space. So over here, it goes into the Eustachian tube. But if there is a blockage there and there's always a negative pressure inside here, over time, it slowly pulls on the eardrum, pulling it inward. And this pocket then becomes worse and worse because of the constant negative pressure. When it becomes such a pocket, it starts to collect dirt inside there. And the dirt, the skin cells and all that, cannot come out. It just gets stuck more and more and more. And over time, this starts to eat away at the bones of the middle ear or the bones of the ear in general. And this will lead to hearing problems. And this collection of dirt can also get infected, leading to pus coming out of the ear and pain. So cholesteatoma is a condition where, unfortunately, there is no medications that we can use to treat. Surgery has to be done. So what we do during surgery is we will remove this entire unhealthy eardrum and we put in a new eardrum, or we make this area here, for example, we make it more gradual so it doesn't have a collection. It can drain out by itself naturally. The next group of management for the obstructed Eustachian tube. So what I've just covered are management of complications arising from this blocked Eustachian tube, which happen in the ear. But what is the source of all these problems? It's usually in the nose and sinus problems. So as I mentioned, we should treat with nasal steroid sprays. But if there are structural problems like a crooked nose, then you will need to do a straightening procedure called a septoplasty. Sometimes you might even need sinus surgery, especially if you have polyps in your nose. Or let me talk about the side profile of this picture now. Okay, so this is a side profile of a human head. This is the ear, the middle ear, and this tube, the Eustachian tube that goes into the back of the nose. So this is the forehead of the patient. This is the nose. And as you go in, these are the sinuses. And over here is the back of the nose, which I mentioned. Okay, near the back of the nose, some people have what we call adenoids, large lumps which are over here, which is very common in children, but much less common in adults. So in some patients where this is a very large adenoid here, it literally blocks the Eustachian tube opening, and this will need to be removed with a surgery. And finally, maybe everything is quite okay. No big polyps, no adenoids. Nothing very major is wrong, but still there's a blockage of the Eustachian tube. Then we do this thing called a balloon Eustachian tuboplasty. Yet another diagram for you. So the ear canal, middle ear, and the Eustachian tube over here. So if it's blocked up, we just put in the balloon, like so. So this is an endoscopic picture of the Eustachian tube from the nose side of it. This is the little opening which is supposed to go into the ear. But in this case, you can see it's really, really congested and blocked up with mucus and all that. So what we do is we put in a balloon, we inflate the balloon for 2 minutes, and then when we remove the balloon, you can see that there is now a hole now, and it's no longer so blocked. So this procedure, most of the time, can be done in the clinic as well under local anesthetic, which means we just numb your nose region. And it's only about, as I mentioned, the balloon takes about 2 minutes, and the numbing process will take about 15 minutes to half an hour. So after this, patients will usually be able to pop their ears more easily. In fact, the swallowing, the saliva can already pop their ears naturally, and they wouldn't have to do any Valsalva maneuver, and their ears are usually less muffled. And this is most oftentimes a fairly permanent procedure, although if things like your nasal allergies are not controlled, they may require a repeat balloon procedure, which is quite simple again. This is a repeating of the same procedure to reopen the Eustachian tube. Typically, this will be years in between the procedures. The one balloon procedure can usually last at least a year or more. Now I'm going to completely change direction, yeah? So some people, they get Eustachian tube dysfunction, which is a condition when it's too open, or what we call a patulous Eustachian tube. So I mentioned to you that the nose connects to the ear, and for them to prevent bacteria from constantly going from the nose, where we always breathe in air from everywhere, to prevent infections from going from the nose to the ear, this tube actually stays closed most of the time, unless we swallow or we yawn or we open our mouth or we blow our nose. And it usually stays shut because of various things, including this little piece of fat that stays here. It kind of pushes the tube closed. And it only opens up when the muscles are activated. So this is a normal Eustachian tube. You can see there's a small little hole, not too big, not blocked the first picture I showed you previously, just nice. On the picture on the right, you can see this same Eustachian tube, but the opening is huge. Okay, so when it's so big, the opening with the connection between the nose and the ear becomes open all the time. What happens then? You always hear your own voice in your ears. It becomes echoey, it becomes very irritating. You might even be able to hear your own breath going in and out. You might even be able to hear your own chewing. And of course, you might feel like the ear just feels uncomfortable and full. One of the causes for this is if you have a sudden loss in your weight, or for example, in some pregnant ladies who do not gain enough weight, then relatively there is loss of fat, and then this will also open up. Of course, if you have problems with muscles, this might also cause a problem. Or if you've had any kind of radiation therapy due to any head and neck cancers, or if you're on medications that you need to be on, which causes drying out. For example, some heart medications where you need to reduce your blood pressure and it helps you to pee more. So by passing more urine, being relatively dehydrated, this may cause the mucus lining to be too dry and for the tubes to be open. Typically, if you have a patulous Eustachian tube, the triggers that make it worse are exercising, drinking caffeine, or taking full medications, smoking. And usually when you're upright, like seated or lying or standing up, it's worse. If you lie down, it usually gets better. Okay, so what do we do again? We check the ears. And then the next most important thing is we will ask you to bend your head all the way down between your knees. And if your symptoms disappear or improve, then you likely have a patulous Eustachian tube. And of course, we end off by doing a nasal endoscopy by checking the actual Eustachian tube opening to see if it's indeed too open. What can we do? Hydration is very important. A lot of Singaporeans do not drink enough water, and so they're dehydrated. So usually just drinking more water would help the mucus lining to be more healthy and reduce the symptoms. And of course, if you are taking any flu medications, you need to stop it because you need the mucus to keep it closed. In some patients where this is not enough, we would give them some nasal sprays to increase mucus production. For those who still have a lot of symptoms, very irritated, cannot hear people talking because the ear is they're just hearing their own breathing nonstop. In those cases, we actually put in an injection of a filler. It's to replace or substitute the fat that is supposed to be there. We inject some hyaluronic acid, which helps to close the tube. For some patients, we can put in the grommet tube, like I showed you previously. That one was to drain water. This is to help the air to exchange. There are also more complex surgeries to literally close up the tube. However, this would risk having a blockage problem. Okay, then you might go back to the first few slides that I had, which is all the complications from blockage of the Eustachian tube. Okay, so I would like to conclude Basically, a blocked ear sensation is often caused by Eustachian tube dysfunction. And the underlying reason is usually arising from the nose and the sinuses. And so that's why many doctors, when you tell them, I have a blocked ear, they don't give you any ear medications, but they give you a nasal medication. So for majority, this is all that's required. For some, they may need nasal surgery. If you have complications arising from that, you might need ear surgery as well, like putting a tube to drain off the fluid, repairing the hole in your eardrum, and removing a cholecystoma. If you have mild problems, a balloon expansion of the Eustachian tube is very effective and can treat it before any complications arise. And that is all. I hope you have understood my talk. And I will take the questions and answers. Is Dr. Vanessa, are you there?
Thanks, Joyce. Yeah, I'm in. Thanks very much for going first, even though you're running a busy clinic as well. So my name is Vanessa, and I'm a consultant with the Department of ENT in SGH. And today I'll be covering a slightly different area that Joyce has shared with regards to causes of hearing loss. I'm just going to share my screen. So with regards to hearing loss, it is important to know the various levels of hearing loss. So if you look at this very colorful rainbow picture here, this is called an audiogram. It's a hearing test we routinely do for all our patients who complain of hearing difficulty. And in this purple zone, whereby the hearing levels fall between 0 to 25 is considered normal hearing. Patients who have mild hearing loss will have difficulty hearing like the sound of a tap dripping. And their hearing levels will fall in the blue zone between 25 to 40 decibels. And the second and third category of hearing loss will be moderate to moderate severe hearing loss, and such patients may struggle to hear well in conversation. And hearing loss can also be severe and profound, and these patients will have difficulty hearing, like let's say the sound of a bus or even the sound of an airplane. And for patients with profound hearing loss, generally hearing aids will not be useful because the hearing aids are unable to amplify the sound adequately, and such patients will be a surgical cochlear implant candidate. So I'm going to play a audio video to let you all experience what it's like for patients with hearing loss. Let me try and get my sound working as well. Okay, so I hope that you can actually hear the singer's voice on this YouTube video.
For once in your life.
So I hope you managed to hear that well, and don't worry if you couldn't hear the segment when the singer was demonstrating profound hearing loss. But I really hope that that video allows us to empathize with patients with hearing loss better, that it is a very big struggle to hear a conversation if you do have hearing loss. So I Joyce also showed a picture of an ear, and I will recap this because I think it's important for us to understand our ear structures in order to understand the types of hearing loss. So our ears can be divided into three compartments. There's the external ear, which is the ear canal. There's the middle ear, which is the area that Joyce was focusing on in the talk. The middle ear is the area where the hearing bones sit, and we have these 3 tiny hearing bones which allow sound to be transmitted from the outside to the inside. It's called the malleus, the incus, and the stapes. And the last component of the ear is called the inner ear, and this is where the hearing and balance organs sit. So problems in the ear canal and the middle ear will give rise to what we call conductive hearing loss. Sound cannot be conducted effectively to the inner ear. And problems with the inner ear will result in what we call a sensory neural hearing loss, which is a nerve-related hearing loss. So problems of conductive hearing loss are managed a little bit differently from sensory neural hearing loss. So this picture on the right shows what a normal eardrum looks like. Our eardrum is transparent, and behind it, you can actually see some of our hearing bones. My pointer is actually pointing at one of the hearing bones here. And a good eardrum, you can see there's also a nice cone of light reflex. So this is a healthy ear. So I've seen a couple of questions pop up in the chat group about whether ears need to be cleaned. So this is a very common question that we get from our patients. And this is a picture to show a patient who has earwax in the ear canal. So in terms of our ears, actually they are self-cleaning. As the skin of our ear canal grows, it grows outwards and it pushes the earwax out. So there's no need to dig our ears. However, there is a very small proportion of patients which have a condition whereby there's excessive earwax accumulation. So this patient of mine actually had excessive earwax accumulation that resulted in an expanded ear canal. The ear canal was widened because of too much wax. And take note, this is not a common condition. And after I clean the ear, you can see this picture that the ear canal, it looks much wider. Here, the floor of the ear canal is much wider compared to the picture on the top, which is the size of a normal ear canal. So this last picture is a picture of my son. I guess he's quite blessed that his mom is an ENT doctor, because he does have this condition of excessive earwax accumulation. And he kept asking me to repeat myself. And eventually I put him to my clinic and was surprised to see that his ear was filled with wax. And after removing the wax, he tells me that, "Mama, I can now hear your footsteps." So I can't really sneak up on him anymore. So with regards to earwax, the earwax is usually produced in the outer part of the ear canal. So this is a picture showing the ear canal, and the ear canal can be divided into a soft cartilaginous area. The cartilage of the ear canal is soft, and it can be divided into an inner bony compartment, whereby you can see here the ear canal is bony and is hard. So the glands that secrete earwax is located in the cartilaginous part of the ear canal. So quite often when you see earwax in your ears, it is actually on the external part, and it's gonna, with the skin migrating outwards, it's gonna come out of the patient's ears. So the problem with digging your ears is that the cotton buds are too big for our ears. They tend to push the earwax inwards towards the eardrum. In fact, a little bit of earwax is good. It helps to trap dust, and there's also some antibacterial properties of earwax. So some earwax in our ears is good. I've also seen patients who are chronic ear diggers, and with chronic ear digging, repeated ear digging of the ears, you can actually cause the ear canal skin to become very sensitive, and you can develop eczema of the ear canals. And in such cases, the skin of the ear may no longer be self-cleaning, and the earwax is unable to expel on its own. So once again, key take-home point is do not dig your ears are self-cleaning. So I'm going to show a series of pictures of some abnormal conditions of the ear. And this picture shows a patient who has dug the ear, and unfortunately, the cotton bud got stuck in the ear. And with a foreign body in the ear, that is a trigger for ear infections. So that's another reason why we advise patients to not dig their ears, because a foreign body can cause an infection. So you can see that in this picture, there's a yellow pus. Other conditions that can cause patients to lose their hearing is when they have an ear canal infection. So once again, you can appreciate that this definitely is not like the previous picture of a normal ear. You can see there's yellowish ear discharge. You can't see the eardrum as well as previously. In fact, the ear canal looks a little bit smaller because it is swollen. So this is a bacterial ear infection, and usually for bacterial ear infection, patients with the symptoms of pain, a wet ear, discharge, a blocked ear, and even a reduction in hearing. Less commonly, we see patients with a fungal ear canal infection. So a fungal ear canal infection has this characteristic spores that we see. So you can see that these black color spores, which are diagnostic of a fungal ear infection. So for a fungal ear infection, it can continue on from a bacterial ear infection. And some of the hallmark features of a fungal ear infection is if the infection is prolonged, and if it's associated with very itchy ears. I know that some patients, even without ear infection, can have itchy ears, so you do need to have other symptoms such as ear discharge. Another key take-home point for patients with ear canal infections is that there is no need to take oral antibiotics, but the treatment for ear canal infections is really to use ear drops. So if it's a bacterial ear infection, we give antibacterial ear drops. If it's a fungal infection, it will be an antifungal ear drop. The reason why eardrops are better than oral antibiotics is because eardrops have a direct action on the problem area. So once again, this is a picture of a normal ear, and I wanted to show a picture of an abnormal middle ear, and Joyce also showed some examples of this as her talk, as she spoke about fluid in the middle ear. So you can see the color of this ear in the middle. There's a yellowish color to it. And this signifies there is a fluid in the middle ear. And usually these patients will also present with conductive hearing loss. She also had she had the same picture just now to show the Eustachian tube in a child and an adult. So once again, to let parents of young children know that it is not infrequent that children get middle ear fluid, really because of the structure of the Eustachian tube. So if you can look at this picture, this is a picture of a Eustachian tube which connects the nose to the middle ear. And you can compare in a child's Eustachian tube, it is shorter, it is more horizontal, and it is also narrower. So for these reasons, fluid tends to accumulate more easily in a child's middle ear compared to an adult. In addition, we also know that children, especially when they enter daycare, they go to school and they're exposed to their friends who have a runny nose, and they touch each other and play with each other all the time. So they are very predisposed to having recurrent flus. So for these reasons, children are very predisposed to having middle ear infections or fluid. So now, just for you to compare what a normal ear and an abnormal ear is like. So this picture on the right side shows a patient who has had repeated ear infections due to ear digging, and how because of the repeated ear infections, the ear drum is no longer translucent. It has now become very thickened with scar, and this patient will have a conductive hearing loss because the sound is unable to be passed effectively from the outside to the middle ear. So this is a picture of an abnormal eardrum that is very thick and scarred up. And Joyce also showed a picture of some patients with a hole in the eardrum. So once again, this is a patient with a hole in the eardrum, and such patients may complain of occasional ear discharge and hearing loss. Next, I will talk about the causes of sensory neural hearing loss. So sensory neural hearing loss is problem with the hearing nerve. Sensory neural hearing loss, the most common cause of sensory neural hearing loss is age. So with regards to hearing impairment, the risk increases with age. And we know up to about 10% of patients aged 60 to 69 years old have hearing loss that is disabling. And about 22% of patients in this following age group have hearing loss. And if you are more than 80 years old, 1/3 of patients who have disabling hearing loss. So age-related hearing loss is the most common. Unfortunately, some children are also born with hearing loss. The incidence of that is about 3 to 4 1,000 babies are born with hearing loss. And I saw a question in the group chat about tumors. So this is a MRI scan of a patient's brain and inner ear, and this is a tumor called acoustic neuroma. So it's a benign tumor, it's non-cancerous, but the problem is that it can press on the brain and cause patients to have balance issues and hearing issues as well. So for these acoustic neuromas, the treatment really depends on the size and the growth rate of the tumor. For growing tumors or tumors which are large and pressing on the brain, usually the patients will need treatment like surgery or radiation therapy. Another reason of nerve-related hearing loss is drugs. So some drugs can cause hearing loss. And lastly, noise is also another possible cause of hearing loss. The good thing in Singapore is the Ministry of Manpower. It does have guidelines for which if the workplace has excessive noise, the employees are required to do routine hearing tests to check their hearing. So with regards to hearing loss, especially for sensory neural cause of hearing loss, the first line treatment is to use hearing aids. And these are different types of hearing aids. And depending on the severity of hearing loss, our audiologists are the experts that will determine the hearing aid that will fit the patient. So we did a study, we do have a paper published in Singapore that talks about hearing aid uptake in Singapore. And unfortunately, our uptake of hearing aid use is very low. Only 7.5% of patients use hearing aids. And this is much lower than other countries. And recently, we have found that hearing loss is the single largest modifiable risk factor for dementia. So there are many things that we cannot change in our lives, like let's say your family history or your age. But one thing that you can change for yourselves to reduce your risk of dementia is getting your hearing loss treated. So in terms of hearing intervention, whether it has helped to reduce cognitive decline, a recent paper just published last year does show that when you intervene with hearing aids for patients with hearing loss, it can slow down cognitive decline. So why is hearing loss associated with cognitive decline or dementia? There are a few hypothesized mechanisms. One is when you cannot hear, you're actually causing more stress on your brain. You're causing more cognitive load on the brain. Hence, there's less reserves left for memory and other functions. Another theory is that they actually share a common pathway. Hearing loss and dementia share a common pathway of altering the brain structure. And lastly, for patients with hearing loss, they have reduced engagement in social activities, and this will thus reduce their stimulation. So the study did find that hearing intervention effectively slows the rate of 3-year cognitive decline by 50% in the global and language domains, especially in at-risk individuals. And these at-risk individuals are individuals who are at risk of heart disease and strokes. And hearing aids are underused globally despite being almost risk-free from a medical perspective. So treatment of hearing loss is a vital opportunity to prevent dementia. So in Singapore, there are various ways that we can have our hearing checked. And for our elderly, more than 60 years old, there's Project Silver Screen, whereby you can check not just your hearing, but also your vision and your oral health. So I encourage all of you, if you are in the elderly age group, to do look out for Project Silver Screen and have your hearing checked. It is definitely a more efficient way of having your hearing checked than being referred to the ENT department, because we do have quite a long waiting time to see us. So for patients who do not benefit from hearing aids, the next step would be to do surgical implants, and that's where the role of myself and Joyce as a otologist or ear specialist comes in, and we do implants for our patients. So in SGH, we see children, and this is one of my pediatric patients that operated on, and I was pretty relieved when I asked him to draw his surgical experience, and he drew himself with a head bandage and a smile on his face. This is another one of my implant patients. She's really a role model and inspiration to all my patients with a cochlear implant, and this is her on the first post-op day. So I use these pictures to say that even for a surgical hearing implant, it is actually, the surgery is pretty straightforward, and it's the rehabilitation process of getting used to the implant that really needs a lot of effort from the patient and from our team. So in SGH, I'm very proud to say we have a really holistic team who looks after patients of all ages, and our aim is really to come together not just with the patients but with their families to bring the joy of hearing and balance to all our patients of all ages. So this is a picture for our annual Christmas party with our patients. So some take-home points: don't dig your ears, they are self-cleaning. And the second take-home point is good hearing helps to keep your brain young. So thank you for listening, and I like this Chinese word that means, for our non-Chinese speaking friends, this word is ting, which is to listen. And to listen is not just about using your ears, but it's also using your head to think, so to be present, to use our eyes to see, and to focus with our heart and our minds. So with that, we will move on to the Q&A.
Vanessa, would you like to answer this question?
Yes, so this question says acoustic neuroma can also cause hearing loss. What is the difference between this benign tumor versus the normal hearing loss? So acoustic neuroma, I'm not sure if you managed to pick up on the MRI scan that I showed just now, but for some of our audience, this is a benign tumor. And this benign tumor is located in the inner ear and at the brain. So this tumor causes what we call sensory neural hearing loss, a nerve-related hearing loss. Whereas I don't think we really call it normal hearing loss, but normal hearing loss, so hearing loss, we can categorize it into conductive versus sensory neural hearing loss. So conductive hearing loss, it is for problems in the ear canal in the middle ear, whereas a sensory neural hearing loss is for problems due to like acoustic neuroma or age-related hearing loss. Yeah, so it's important to know the categories of hearing loss, which is a conductive or sensory neural hearing loss, because the treatment will vary.
Okay, I'd like to take this question. So how to resolve the pain in the ear, like knife cutting when taking planes, especially landing? So it is exactly what I mentioned in my talk, which is the symptom of a blocked Eustachian tube, which you will have pain in the ears, especially when on the descent of the plane. So one simple way would be to try to blow your nose, to pop your ears, to take a sweet, to swallow your saliva, to drink a cup of water. Or you can, if you have a flu going on, especially before your trip, I highly advise taking some flu medications, or you can even purchase some decongestant nose drops from the pharmacy. It's usually over the counter. And those medications are suitable for use for a short duration of a few days, 2 to 3 days. And they should help you to prevent this pain when you are taking the flight. If you constantly have a problem with equalizing pressure, then you can consider coming for a consultation. You may require nasal steroid sprays, you may require sinus surgery, you may require the balloon tuboplasty to resolve this Eustachian tube dysfunction problem. So as mentioned, chewing and yawning will help to balance the pressure. I have had a patient who has given me the feedback that using a rubber plug in the ear does help as well. I think it's because the rubber plug seals in the air outside the eardrum and behind the eardrum. And so because there is no change in the pressure, then there is no more pain. But that is just to treat the symptom, and the underlying condition is actually still the Eustachian tube dysfunction. I hope this answers your question. So what is the cause of having a hole in the eardrum? Typically, this is caused by an infection. It can also be caused by having some kind of injury, for example, a slap to the ear, or someone, I once had a child who put a pencil in the ear. The more typical cause is an infection. The infection can result from an external ear infection that also infects the eardrum, or more typically, it comes from the middle ear, from the nose to the middle ear, and then the middle ear pus then causes a hole in the eardrum and it escapes out through the hole in the eardrum. So ear infection causes the hole in the eardrum. Hope this answers the question.
So there's a question about noise-induced hearing loss, and I see some other people with a similar question. Will constant use of an earbud like 3 to 4 hours a day, say at 50 to 60% volume, accelerate hearing degeneration? So in terms of noise-induced hearing loss, there are two main factors that we look at. One is the sound intensity, and one is the duration of noise exposure. So in terms of sound intensity, we use this unit called decibels to measure it. And in terms of what is considered a loud noise is anything that is more than about 80 decibels of sound. So if more than 80 decibels of noise, then it will require continuous 8 hours of exposure. So quite easy to remember, 80 decibels at 8 hours for noise-induced hearing loss. So with regards to the noise-induced hearing loss, if for every 5 decibels increase in sound intensity, so let's say if the noise is at 85 decibels, the amount of exposure time in fact is halved. So if you are exposed to 85 decibels hearing sound intensity, you can only be exposed to it for not more than 4 hours. So with regards to earbuds, using it at 50% volume, I would say is safe. There are certain apps on our phone and our devices that can also tell us about the sound intensity. So I myself, I use a iWatch, and it can, whenever the environmental sound is more than like 70 or 80 decibels, the watch can actually vibrate and alert me. So it is useful to use these apps to alert us when there's excessive noise. And to bear in mind, our body is actually quite smart. So whenever it is exposed to excessive noise, your body will send feedback to yourself, and the feedback can be in some symptoms, such as let's say if you feel pain in the ear. I saw some questions about pain when exposed to loud noise. Pain in the ear is actually a protective mechanism for the ear to protect itself from loud noise. So pain in the ear. During Taylor Swift concerts, we also had some patients complaining a bit of muffled hearing or even tinnitus following loud noise exposure. So sometimes we call this what we call a transient threshold shift, whereby patients' hearing changes transiently after a period of loud noise exposure. So if you do have like symptoms such as tinnitus or muffled hearing, then that is actually your body trying to tell you to reduce the noise exposure. Yeah, so I would say that 50%, 3 to 4 hours per day with the earbuds is safe, and it would be advisable to use certain apps to have further awareness of what the sound levels are like in your environment. So the next question also is, which I saw a few people ask, what causes humming in the ears at times? So the medical term for humming is called tinnitus. So for tinnitus, it can be many causes of it. In fact, any problems with the external ear, middle ear, and inner ear all can cause tinnitus. And for patients with tinnitus, some of the red flags or some of the warning signs I'll look at is if the ringing sound is one-sided, if it's in one ear, if the ringing sound it is associated with other symptoms such as giddiness and hearing loss, and if the ringing sound actually sounds like your own heartbeat. So patients who may be hearing the blood flow in their own heart, such as a sound, these are certain symptoms that will make me be a bit more concerned. Another group of patients that I'll be rather concerned if they complain of tinnitus is when they start to feel depressed. So patients with very loud tinnitus can actually have insomnia problems and feel depressed. And these group of patients, we will send them for tinnitus counseling because we want to teach them certain coping strategies to cope with the humming sound. And also sometimes we even give them some medications like a melatonin, which is a sleep hormone, to help them sleep better. Otherwise, by and large, for patients with bilateral tinnitus, quite often the hearing tests do come back normal. And for such patients, we actually don't have any known cause for the hearing loss. And this is actually one of the most common things that we see in our ENT clinic. And for these patients, if the hearing test is normal and there are no worrisome symptoms, we reassure them that the tinnitus will not cause them to grow deaf. That was another question I saw. The tinnitus will not cause them to grow deaf. We will teach them certain coping strategies like distraction techniques. And most importantly, you really need to have good rest and try to do things to help yourself relax and be distracted from the tinnitus, because the more you listen to the sound, the louder it will be. So we'll teach them certain relaxation techniques to cope with the tinnitus as well.
Okay, this question is, I have an infection in my left ear and I have hearing loss with pus flowing out, and the doctor says it's an infection. How could I have prevented it? This is an excellent question. So ear infections are either from two sources, from external, which means that it is introduced in by something going into your ear. For example, the most common culprit is a cotton bud usage or any kind of ear digger that then scratches the ear, which then causes bacteria which live on our skin normally to be able to go inside and cause a deep infection. Or, for example, cotton buds tend to implant in fungus infections into the ear canal. So this is one cause which is easily preventable, because if you do not dig your ears, then you will not introduce infections from externally. The other way infections can happen in your ear would be from the nose. So if you have a flu, cough, cold, flu, or URTI essentially, and the infection from your nose, if it spreads to your ear, then you will get a blocked ear, pain in your ear, and then the pus may come out from the ear as well. It's very difficult to prevent infections, but we did notice that during the COVID period, where everybody was wearing their masks and everybody was very careful with hand hygiene, that the rate of having cough, cold, and flus went down drastically as well. So, well, if you are careful with your hand hygiene and avoid people who are coughing and sneezing, then maybe that way you can prevent infections. Hope this answers your question. Okay, so in this other question, with this person has experienced a sudden hearing loss diagnosed as labyrinthitis. This is a condition where the inner ear is inflamed. And now she's wearing hearing aids and has difficulties hearing conversations and experiencing blocked ears. So if the hearing aids that you wore was able to help you initially with hearing conversations, but is now unable to help you, meaning there is a change, please see your audiologist, because maybe your hearing aids might need to be serviced, or you might need to turn up the volume of your hearing aids as your hearing loss progresses or gets worse with time. This can be due to aging processes, since it is 10 years ago that you first got your hearing aids. For the blocked ear sensation, as it could be due to earwax accumulation, or it could be due to middle ear problems, I would be unable to really comment on this. And so my advice would be to first see the audiologist. They are usually able to check your ears and tell you if it's obviously blocked. And more importantly, they're able to fine-tune your hearing aids, because you may have had a worsening in your hearing level. And if the audiologist says that the hearing aid is working fine, but you still have the problem, please see an ENT doctor. Thank you.
So thanks everyone for your very enthusiastic questions. We apologize that we are unable to answer all the questions because there are almost 100 questions, but we do hope that you have learned something from our talk. And yeah, feel free to see your polyclinic doctor for further advice, and they will always refer on to ENT if necessary. Have a great day.
Thank you. Bye-bye.
Bye.